You're listening to the RN Mentor, a podcast designed to document and bring you the work and experience of some of the most influential nurses in our profession. We will be sitting down and having a discussion with the leaders of today's nursing world as they share their work, how they navigate their nursing path, and their views on the future of the profession. My name is Ali Tayeb. I am a registered nurse, United States Navy veteran, a Jonas Veterans Healthcare Scholar, and your host for the RN Mentor. Hello and welcome to another episode of the RN Mentor podcast. I am very excited to be joined today by Captain James Dickens. Captain Dickens is a commissioned officer in the United States Public Health Services Commissioned Corps, whose mission is to promote, protect, and advance the health and safety of the nation. Captain James Dickens received his Doctor of Nursing Practice from Texas Tech Health Sciences Center in Lubbock, and currently serves in the U.S. Department of Health and Human Services Center for Medicare and Medicaid Services, Dallas. Previously, he served in the Office of the U.S. Secretary for Health as the Senior Program Manager for the Office of Minority Health in HHS Region 6. He is an experienced registered nurse and board-certified family nurse practitioner with over 30 years of federal healthcare experience. Captain Dickens also served as the officer in charge of the Commissioned Corps Ebola response at the Monrovia Medical Unit Ebola Treatment Unit in Monrovia, Liberia, West Africa, and as the USPHS officer in charge of the COVID-19 response, and as the officer in charge of USPHS Operations Artemis response for unaccompanied children. Captain Dickens is a fellow of the American Academy of Nursing and the American Association of Nurse Practitioners. He is also the recipient of the American Association of Nurse Practitioners National Towers Pinnacle Award, the Texas Tech Health Sciences Center School of Nursing Excellence in Clinical Care Award, and recipient of the Meritorious Service Medal, the second highest honor award in the USPHS. Welcome to the show, Captain Dickens.
Thank you for the opportunity and certainly the opportunity to address our colleagues.
Thank you. I appreciate your time and making yourself available. I have lots of questions for you just because I'm curious about the work that you do. But before we get started with that, we'll start how I start every show is, how did you get started in the world of nursing?
Well, I wish I could say that I had a dream and Florence Nightingale came to me in the middle of the night, but unfortunately that wasn't the case. I started off as a corpsman or a medic or a bedpan commando in DOD for the Air Force. And my thirst for the quest for medical knowledge increased during that time. And I started off as a surgical technician, went on to do the medic program, EMT program, and sequentially did an associate degree, bachelor's degree in nursing, master's in nursing. But mine has all been affiliated with the federal government, and with my professional career has been affiliated with me being a part of the federal government in some capacity for the last 30 years. And so very fortunate in that regard, but I was not a true pipeline student. I took the long and sundry route to get to where I'm at.
So you mentioned you were, and by the way, thank you for your service in the military and your continued service with the USPHS. Now I have a question for you, because I was a corpsman in the Navy. That's how I got my start in life, and that's where kind of my passion kind of continued with the medical world. So how did that experience really bring you into nursing, right? Like what was the transition that you said, like, I want to do nursing, and you didn't go to some other professional route?
I worked in the operating room as a surgical scrub nurse, and I was suturing and putting in catheters and IVs long before I ever became a nurse, probably 14 years before I became a nurse. So I was, bright-eyed and bushy-tailed and working in the operating room at a very high level on, very sophisticated cases in the military. We get an opportunity to work above our scope a lot of times with the supervision of nurses and physicians and the like, our allied health professionals and what have you. And I read an article while I was in Alaska. Actually, I was stationed at Elmendorf Air Force Base in Alaska, Anchorage, Alaska. And I read an article in a nursing magazine that one of my staff nurses, OR nurses, had left in the room. And this magazine article talked about the future of nursing, and this was pre-future of nursing, but it talked about the future of nursing, like the nursing, there would be a shortage of nurses for 30 years. And my being a son of the South and from the Mississippi Delta in Northeast Louisiana, my little pea brain got to churning, and I thought maybe this is the route I should go. I won't have to worry about any layoffs or any job insecurities for the next 30 years. And lo and behold, it has worked out to that way for me. And I've had the privilege of working with all of our DoD counterparts, Navy, Air Force, combat medics in Afghanistan and the like, and have a healthy respect for them. And a lot of those guys and gals have transitioned from corpsmen, combat medics, and the like, surgical technicians like myself, into nursing, and have made a profound impact on the profession of nursing, and as nurse practitioners, academics, and the like. So we've done a lot in that space. But that genesis really came from reading that article. And I couldn't tell you the magazine. I couldn't tell you if it was a long article. At that time, it probably was a pretty short article because my attention span didn't seem to be that long as a young adult. But I read that article, and it clearly stated that the career field for nursing was going to be a great need for the next 30 years. And again, fast forward to 2022, and that's where we are.
That's awesome. It's weird how these sort of light bulbs go off for us as we do things. I had no intention of going into the nursing world. I had worked with a couple of really great PAs, and they had talked me into the PA world. When I left the Navy, I was looking into PA, and the bachelor's degree PA program became a master's degree PA program. And I said, there's no way I'm doing a master's degree. So yeah. I'm like, what else can I do? And I looked at
just like you, I got accepted to the University of Washington's community program for PA. And I think it was an associate degree. You had to have enough hours for an associate degree, and you were awarded a bachelor's. And so I got accepted to that program, and it was a community-based program. But all the CRNAs in Alaska that I worked with in the operating room were adamant about going to nursing school, but you had to have a bachelor's, because these guys were dinosaurs. They were all diploma CRNAs and had went to a one-year program in DOD to pass gas or to provide anesthesia services.
Right.
And it was a one-year completion program. And so that's what prompted me to go down that road. I really wanted to be a CRNA, but as you indicated, all the programs started to elevate from baccalaureate programs to master's level programs. And a lot of the CRNA programs started to close down because they were, 7-chair programs, very small programs. Not all, but a lot of them were. Some of the DoD programs and some of the larger schools were a little bit larger, but that was the impetus. And I am happy to say that all my degrees have been paid for by the federal government in some capacity. So DoD, as you're well aware, the GI Bill and the like. I got my bachelor's funded through that. I was in a HRSA program for my master's, as well as Air Force Reserves. And then my doctorate was paid for by post 9/11 GI Bill. So I've been very fortunate. It's been a very rewarding career for the last 30 plus years, and I have no complaints in this space.
Wow, that's amazing. That's amazing. And that's a good thing to note. Now I'm gonna track back a little bit just because I'm super interested in where were you in life when you decided that you're going to join the military? Because a lot of people, like including myself, I used the military as a way of, I had really no other path. I wasn't raised by a single mom. Lived in a tiny apartment and didn't do very well in high school. And I didn't have a lot of other pathways. So this was really a pathway for me to do something with my life because I did not see college in my future. So I used the military as a way, and I always had I had a like for the military. So that's kind of why I went that route. How did you choose to go into the military that eventually led to this awesome career that you're living now?
Yeah, and that's a great question, one which I'm rarely asked. But and again, to revert back to that time mentally, I was in a very precarious situation. I could have went left or right, and versus staying on the narrow pathway. But I had a friend who's passed away since then. He and I made a deal. We went to college initially on football aspirations, and I was on a football scholarship. Like yourself, didn't do well academically in high school, just did enough to get by. My parents weren't college educated and didn't really, I mean, the whole college process, I had to kind of find my way through because they just didn't have the skill set to help me navigate that system. And so my first attempt at school was not a good one. I mean, I loved to play football and I loved all that athletics brought me at that time. But I found myself at a crossroads, and I made a deal. My best friend and I had made a deal that if either one of us dropped out of school, we would get out of the Delta in Northeast Louisiana by going into the military, because I saw that as a clear pathway. Now, the educational component wasn't even important to me at that time. However, when I got into the military, I was able to see that sit through these courses, because I tell a lot of young kids, they say, "Oh, I don't want to go. I'm going to the military. I don't want to go to college because I hate school." I'm like, well, military is the worst place to go if you hate school, because if you are a tank driver, you're going to go to school to learn how to drive a tank. If you are a mechanic or whatever you do in the military, there is a school associated with it, as you can attest to. Right. And so I tell anybody that says, "Oh, I don't want to go to school. I want to go to the military." I'm like, well, let me just tell you, there's a lot of schooling with the military. As the professional military education courses that you get throughout your career, whether you're enlisted or an officer. And so I wanted to throw that out for anyone that may hear my voice and this podcast regarding that, the education is very important in the military, and you get that throughout your career, just like we do as nurses, if you're a lifelong learner. And that's what I've learned. I'm a lifelong learner. And to answer your question, that was the genesis for me going to school. I had made a pact with my best friend, and I was the first one to drop out of college at that time. And he said, "I guess you're going to be joining the military." So I started making my rounds with the recruiters, and ended up meeting a recruiter who told it like it was, didn't lie to me. He said, "You see all that stuff you saw in the recruiting film?" He said, "That's all poppycock. That's not how it is." And he said, "But we use that to lure people in the door, and we show this to high school kids and so forth and so on." But he was very frank and honest. And even after I joined the military and went to Alaska, he and I stayed friends for a period of time, probably a good 4 or 5 years, until he retired. And I kind of lost track of him at that point. But that's kind of how it started for me. And thanks for asking that question, because very few people ask me what prompted me to go the military route.
Yeah, I think it's an important I think it's an important thing to ask, just because, like I said, so many people think of the military as a way of getting to the next step of their life, right? Sure. And especially with me, I know I lacked direction. And one of the things the military did do, I didn't go to school in the military. I dropped out a couple of times because of deployments, not because of, but I had some growing up to do before I went back to school, and I did really well when I went back. But I just didn't have that drive in high school or after high school to be. I just didn't have that. And same with you. My mom was I'm a first gen college graduate as well, so it's even though my mom's graduated from college a couple of times now since, and she's doing fantastic, but we didn't have a whole lot growing up, or I didn't have, or because my mom and I didn't have a whole lot growing up, so this was it's important.
The humble beginnings are certainly one of those spaces, but again, I think it's like how you take advantage of it. I just didn't have a break in service for 30. I'm at my 37th year in uniform since 1987. So whatever that 30 plus years, I'll retire at the end of this calendar year with 29 years active duty. So
Wow.
Again, I have no complaints. But I never had a break in service. And if I had to design my career on paper from high school or wherever, I could never design it as well as it's gone for me.
Yeah.
And like you said, coming from humble beginnings, and that's why I give people a point of reference where I'm from, where the Duck Dynasty's guys are in West Monroe, Louisiana. That's my hometown. And so for a minority person coming out of that space, I'm a black face that's not in a lot of different, in these spaces that you would see now, from a leadership perspective, from a nursing perspective, and a fellow, double fellowed and things like that. But it's also a culmination of all the people that invested time and energy into this guy, and that's what we both are, a product of those environments that we come from. So I'm not trying to minimize my upbringing, because I think there's something special about growing up in that environment, and you can't quantify grit. I've never seen that on any survey that I've taken about grit and tenacity. That can't be quantified, and I think that's what we exhibit in this space.
Yeah, I appreciate it. And I appreciate your voice and your contribution. So thank you for sharing that. Now, fast forward a few years, and let's talk about your work now. Well, before we get there, I really want to ask you. What I really want to ask you is you've done quite a bit. You've been to Afghanistan. You've been to the Ebola response. That one component scares the bejesus out of me. You've done COVID work. How have those experiences been for you? Well, what has been your role, and how have those experiences kind of formed your career?
Well, I've had some good nurse leaders that have given me the opportunity to be in these spaces. One comes to mind is Rear Admiral Susan Ortega, who is the senior advisor to the ASH right now, the Assistant Secretary for Health, Dr. Rachel Levine. One that comes to mind too is Rear Admiral Trent Adams. Both of these, and Rear Admiral Trent Adams has retired, and she's here in Texas at UNT Health Sciences Center. But she, those folks have put me in a position to succeed, and saw something in me, and put me in a position as a nurse exec, nurse leader in these emergency preparedness spaces. And those opportunities, every opportunity, or whether I wanted to or not, I've taken advantage of those opportunities that have been given me. And what I did early on in my career, as you well know, in your military career or your uniformed services career, when I transitioned to the public health service over 20 years ago, I've never had no in my vocabulary. I was just telling a colleague earlier via email that he said, well, CMS doesn't go abroad. I was like, actually, that's not true. I have a mentee that's in a small office in CMS that does overseas missions, and they confer with other governments. But with the federal government, I've been to the USVI, I've been to Saipan, Guam, Japan, Korea, and Afghanistan, some good, some not. But these emergency preparedness spaces, as a nurse leader and a nurse exec, has put me in spaces for global health that I never thought I'd be in. And people like, well, what kind of formal training do you have? I'm like, on the job. That's the formal training that I have. It's been on the job training, because as you indicated earlier, going to Africa was intimidating. I mean, extremely intimidating, because most of the time in uniform, you like an enemy that you can see. And, Ebola, you couldn't see. You couldn't see until they were in the wet phase, right? And they were, hemorrhaging and other things going on in that space. But so my biggest fear there was getting everybody home alive on the team, not worrying about my own safety. As you can imagine, your loved ones are panicked and freaked out because we don't know a lot about this disease. Same thing with COVID. Didn't know a lot about COVID. We knew some things, and everything has morphed and pivoted as we moved along with CDC and the guidance that we received from WHO and others. And sometimes the guidance is conflicting because the data is still coming out. And every time someone comes out with a new study, it has to be validated. It has to be put through the ringers to make sure it's legitimate. And so I guess those are some of the high points in my career, those responses that you referred to. But here in Region 6, HHS Region 6, we've had, going back to Hurricane Katrina in '05, we've had a number of, I've had a number of experiences along the U.S.-Mexico border, the unaccompanied children that you talked about, which is almost happens yearly here in Region 6. Had an opportunity to deal with that. The number of hurricanes, wildfires that we're dealing with currently in New Mexico in our region, and floods and anything else, almost everything but locusts and famine we've had to deal with here in HHS Region 6. And we have the dubious distinction of having more federally declared disasters than any other region in the nation. And so if you ask me, have I had an opportunity to sharpen my tools? Absolutely. Not by wanting to do that, but because being here in this region, you almost have to do it. And you know as well as I do, the populations that are usually adversely affected are the at-risk populations from the beginning. They're just magnified in the time of crises. And so trying to build that resiliency and capacity within the community and within the region has been like kind of my life's work. In uniform has been my life's work there.
Well, thank you for all the work that you've done. It's amazing. The only reference I have to Ebola is when we started training all of our staff for how to put on and take off PPE as it related to Ebola. That's really my only exposure to it, thankfully. But yeah, it's amazing. Now one of the things that before we started recording, I mentioned to you is I don't know the scope of the USPHS. And if you can talk about that, why you are part of the uniform services, but we don't really hear about it that much.
Sure.
And what's the role and how it impacts really everybody?
Sure, and it's in the name, the U.S. Public Health Service. We've been around since 1876, one of the oldest uniform services. This service, there are 8 uniform services right now: the Army, Navy, Air Force, Marine, Coast Guard. You can think of those off the top of your hand because those are the armed services. Then you have Space Force, which is the newest uniform services. You have NOAA, the National Oceanographic and Atmospheric Administration guys. Now, I call them the hurricane hunters. That's usually the easiest way to describe those guys. And then you have the U.S. Public Health Service. Most people can identify with the Public Health Service if in our age group, if we bring up C. Everett Koop, because everyone knew the Surgeon General C. Everett Koop. He brought the uniform back. He was an imposing figure from New Hampshire, from Dartmouth. I think he was a pediatrician, if my memory serves me correctly, and he had a nice beard, wore the uniform, was very striking, and he also put the labels on cigarettes. If you look at the pack of the side of the pack of cigarettes, it says that Surgeon General's warning, and that was the first Surgeon General's warning that we, again, our generation can attest to, that the Surgeon General had a big and let me just be clear, that was very controversial at the time and almost cost him his job, but he was adamant about putting that on cigarettes because the data was overwhelming. But the Public Health Service, we serve in all 50 states, territories, and around the world with the FDA, a number of agencies, but some of the bigger agencies are FDA, Indian Health Services, Federal Bureau of Prisons, Immigration, Custom Enforcement. We serve at NIH, CMS, as I'm with CMS. And so we serve all across the government. Back in the 80s, we had public health hospitals, but as a cost-cutting measure because of inflation under President Reagan, those hospitals were closed down and the commission corps officers were farmed out to other agencies. So we still wear the uniform. I'm considered a captain, as you indicated, equivalent to a O-6 colonel, and or captain in the Navy, as you're aware of. But so we work in all facets of response and recovery for the U.S. government, and we're your first line of defense for anything public health. We're at CDC. I omitted that A lot of our officers at CDC have been working 24 hours a day in this COVID space in their operations center, and the Surgeon General has an operations center we call the cell, which I was in DC working in that one as well. And we stand that up anytime there's a national crises that we have to respond to, or international crises for that matter. We stand that up, and we work alongside our DoD and VA counterparts. There in the national emergency plan or a national emergency plan. There's a essential function called ESF 8, and ESF 8, who sits on that council, that's all the federal assets that are responsible for health. And so public health sits on that, DoD health sits on that, VA sits on that, and a few other smaller agencies that you may or may not be aware of, that we sit on what they call the ESF 8 council. And that council determines what federal assets, DMAT teams, disaster medical assistance teams that are available to be utilized in the federal government's arsenal. We may have come to a state near you or some of our listeners for COVID, for monoclonal antibody therapy, for COVID response, and helping our states when they were overwhelmed, or local communities. So I was in DC, and I was able to send officers to tribal communities to assist that were overwhelmed, Navajo Nation and other nations, tribal nations that were overwhelmed by the pandemic. And we sent them all across the country to Puerto Rico and as far away as Guam. We sent assets there as well. And then, of course, you have your officers that are assigned to WHO working in that space. And most of these folks are nurses and docs and epi types that are working and cut their teeth in that space.
Wow, that's amazing. Like it's the sort of a like you don't really see it, right? You don't, and it's not very much like publicized. Like this is what we're doing. So it's amazing that there's these tentacles that are really global and making impact and change. And so thank you for that explanation.
Sure.
Now here's another question for you, just because I think from a nursing perspective, we don't. When we, as it's one of my pain points that we don't, and one of the reasons I have this podcast is we don't hear enough about what nursing does outside of direct bedside care, right? So if somebody was listening to this and didn't know you existed and wanted to, how does somebody come into your arena and make a career out of it?
Yeah, great question. My career path is non-traditional. I'm a nurse practitioner by training, but I don't routinely see patients. I do in disaster response. I had when I was in Africa and down on the U.S.-Mexico border and things like that, and during hurricane responses. But you're right. The easiest place to go, we are a well-kept secret. We don't have enlisted officers that you can enlisted personnel where you can matriculate right out of high school into the U.S. Public Health Service. We come in previously degreed doctors, nurses, dentists, therapists, pharmacists, and the like. So you can go to USPHS.gov. And again, that's United States Public Health Service.gov. And you can get a lot of information. We've also started a reserve component. When I initially came into the U.S. Public Health Service, or what we affectionately call the Corps, when I came into the Corps, we had a reserve component, and that went away because of legislative changes and so forth, and reorganization of assets across DoD and some of the drawdowns that occurred. But that ready reserve has been stood back up. But again, all that information is available on the USPHS.gov. And so if you want to be what we call a weekend warrior, a healthcare warrior, there's opportunities. If you want to do it full time, there are opportunities. You have to do the same kind of commissioning physicals, or if you remember back when we went to MEPS and we joined the military, you still have to go through a qualifying physical to make sure that you don't have any disqualifying ailments, medical issues that are going on that may limit your ability to do your job in an emergent or urgent situation. So USPHS.gov, and I'll throw that out for the last time as my PSA for the Public Health Service.
Awesome. And I already actually have that link set up on your website. So when this podcast goes live, it will be on the RN Mentor website. So
Great.
so fantastic. Now I have a so is there an age limit where people can join like there's in the military?
There is. Usually the age limit was 40, and I think we've increased it for nurses to 44 because of the nursing shortage. And one thing I did want to add, and I didn't address this with you in your former question, your initial question, was the non-traditional scope of work that I do. So right now I sit in CMS, and I'm over about, me as well as my team, we're over about 2,000 nursing homes for
Wow.
HHS Region 6. 1,000 of those effectively sit here in Texas. And so we do survey operations for long-term care for about 2,000 of those nursing homes. And so it's very equivalent to Joint Commission if you're not familiar with the State Operations Manual for Long-Term Care and the federal tags or federal deficiency citations that go along with long-term care to ensure that our beneficiaries, the health and safety of our beneficiaries in the regions or across the nation. But that's another space that if one would have told me that, hey, you would be the branch chief for this division across 5 states and over 2,000 nursing homes, I was like, well, you bumped your head because number one, I don't know what you're talking about. And number two, I'll be touching patients until the day I die because that was where my passion is. And what I found personally is that my impact is greater over 5 states than it is with, working in a hospital or working in a clinic where I'm seeing, a patient panel of however many, a few hundred patients where
Right.
now I have the capacity to, and with the public health service, I not only have the capacity to help a few states, I have the capacity to help the nation or an international community, a global community. So wanted to throw that out as well.
Thanks for bringing that up because that's one of the sometimes when I'm talking to colleagues that are bedside or doing that one-on-one care, they can't see themselves not doing that one-on-one care because it's a different kind of satisfaction, right? It's a different
Absolutely.
kind of an impact. You don't always see that smile on the face when you discharge a patient. That's all better, right?
That's
But
right.
you have to stretch your own imagination and look at the sort of the larger picture of how many people
Right.
you're impacting.
Yeah, and you look at the global impact. I mean, if I'm waiting around to get a bouquet of flowers from family members or get the Tiff's cookie treats at my door from a satisfied client necessarily, that doesn't often happen. But what I can say that I'm excited about my job every day, and I don't say that because I work for the government and I'm at the end of my career in the military. I mean, I really wake up to do an impact. My wife can tell you I'm chomping at the bit to do my work. I'm passionate about it. I mean, and I hope that shines through in this podcast. I'm excited. I'll talk to a stop sign if they want to know about what I do for CMS as a nurse consultant. And if you're interested in a job as a nurse consultant with CMS, and I've just hired 3 nurses. I've hired 2 RNs and 1 NP. And I hired the NP from a level 1 trauma center, which is almost unheard of. And I'm just ecstatic about what we do. And if you're interested, go to USA Jobs and look under HHS Nurse Consultant for something in that space. But love what we do and wouldn't trade it for anything else in the world. I really must admit that.
That's amazing. That's amazing. Now you mentioned some of the mentors you've had in your career, and sort of the military structure is really set up for that. Personally, coming out of the military, it's been a little bit more challenging because I was in the military for 10 years and I was like, oh, I know there's always somebody that's looking after you. And, especially when they see potential. I had a hard time leaving because I was bribed with a promotion. Like a week before it was my discharge date. I'm like, no, I can't. I gotta go. But so it's been a little bit more challenging. And again, another reason this podcast came to be, because I want to make sure people are hearing more and more from the people that are really successful in different arenas of the profession, and their pathway of getting there. Now you're coming to the end of your military career, right? And you're
Correct.
still super young. So what is next for you, and how do you see? I'm going to preload this for you. How do you see yourself mentoring others as you move forward in your professional career?
Yeah, and I don't think the mentoring ever stops for us as nurses, whether you're mentoring people in your church, synagogue, mosque, wherever. I don't. I think it's innate to nursing. Some of us, my wife's a nurse, and she doesn't warm up to that necessarily, the mentoring piece and the whole 9 yards. I push her in that space. She just wants to see patients and go to her meeting and get her CEUs and go home. That's not a bad thing,
Right.
right? That's not a bad thing, but we have to meet people where they are. And my mentoring will continue through AANP, through other avenues. I have mentees all over the country and a couple that are international because their husbands are in DOD and they've graduated from nursing school and they're overseas with their spouses. But we meet on Zoom just like, there's so much interconnectivity now. The only thing that she has to do is get up in the middle of the night and meet with me because I'm not getting up in the middle of the night right now. And I'm the senior. So I feel like if I can take the time, then she can, do a day or two every couple months to meet. But I meet with people all the time, and I don't think that'll stop. I do have an adjunct faculty position at Texas Tech Health Sciences Center there in Lubbock. And so anytime there's an opportunity for me to educate the masses about either the public health service, HHS, emergency preparedness, nursing, not necessarily in that order, I will do it because their career has given me much more than I believe that I could ever give back to the profession of nursing and to the body of knowledge. And so I'm just very fortunate in that regard. But I don't see that changing. One of the things that I did is because I am a old crusty and old sea dog. By self admission, right? We can say that because we're DOD personnel and we know what that means. It's not derogatory in any regard, but I hired a young person who was like 26, brand new nurse practitioner, dual certified. I think she's family and psych, and I hired her because she coaches me about how to interact with my younger peers, right? Because I come from a very rigid environment. I only know the government and when in charge, take charge. And right now I'm at the top of the dog pile, so to speak, of being in charge in most instances.
Right.
And so I need that young person to guide me. And they're going to give you everything they got, usually from 9 to 5, but 5:01, they want to be at happy hour. And I need to understand that they're not going to work 7 days a week, 24 hours a day like my generation necessarily. And I would argue that that's not necessarily healthy, what I do. But that's how I was ingrained and brought up in the career and what have you. But I don't see that changing, but I think it's reciprocal, bi-directional in terms of me being mentored and me mentoring folks as I move forward.
Yeah, but very well said. And that's one of the things I still have I have issues with, just because my career in the military, there was no such thing as overtime or necessarily when is my time off or weekends and stuff like that. You kind of are like, what? You're gone for 3 weeks. You're gone for 3 weeks. That's what you're doing.
Yeah.
You're deploying, or you're
Right.
here, or you're away for 6 months. And
Right.
those are just
Right.
the
And those lines
realities.
those lines unfortunately get blurred for people like me. And then you apply that to other people. And I have civilian personnel that work for me.
Right.
I have a few people in uniform, but half my staff's civilian. And so there are implications when I ask them to stay beyond their 8.5 hour day. There are financial implications for my organization. And they have a master labor agreement as well for the union. So I have to be cognizant of all those
Right.
things when I'm asking them to do, whether it's travel or what have you. For you and I, if we're deployed, we're deployed. You're 24/7, 365, not even a question. And so when you're dealing with others, and particularly some of our younger colleagues, we have to be understanding and understand that there are parameters around that. And so again, being an old salty dog, trying to learn new tricks as we move along,
Exactly.
has proven to be beneficial in the hiring practices as well.
Awesome. Thank you for that. I want to be cognizant of your time. Anything else that you want to share with our audience?
Well, no, and thank you. It's certainly a privilege to share your podcast with you. And as I share with you early on in our pre-production work, I've been kind of stalking you from the perimeter and not expecting an opportunity to do this or wanting an opportunity to do this podcast, but certainly recognizing a lot of the players on your podcast, and man, I was like, man, that's pretty goddamn cool. That's pretty doggone cool that one of our own has done this and understand the mentoring. But one of the things I would say that if you're having a hard time finding a mentor or an executive coach or the like, go to Upworks, go to Fiverr, and find an executive coach that you can afford. But also remember, what you pay is what you get. But look for an executive coach, and I would encourage you they don't have to necessarily be in nursing. I have coaches that aren't nurses because I don't want a slanted view of the conversation. I can find nurse exec leaders to mentor me, and I've had some good ones. But I would encourage you to look at a mentor, look at an executive coach that can be objective and help you process this. I've had an executive coach since I was a lieutenant commander. So going back to like 2008, 2010, I've had an executive coach. Now I have to say she's a psychologist as well. So I've been very fortunate to get a twofer, right? Get the behavioral health component of that as well as the executive coach piece. But I know Duke has an executive coach program or a health coach program, and you may be able to find someone out of that program. And I'm not advocating for Duke. I'm sure there are many others as well. But my coach came out of that program, and I've been with her paying out of pocket since, like I said, 2008, right around the time I was going back and forth to Afghanistan. And so I just felt like I needed someone to help me get through the program. And get through the program of life, so to speak, or nursing in my career and in the U.S. Public Health Service. And it served me well. I did a below zone promotion to O-6, and she was very instrumental in me finishing my DNP on time, which I tried to drop out of the program twice, but she thought it was ill-advised and made me stay the course. And so when I got my degree, I photocopied her a copy. I said, well, this is your second doctoral degree, because she's a psych PsyD, I think, psych doctor. And I sent her a copy of mine because I felt like she deserved it as well, because she really talked me off the ledge quite a few times in terms of, I'm pulling the trigger. I'm gonna pull the parachute on this when I'm done. It was overwhelming and the like. And so, but I think is the last parting words is to consider getting a coach or a mentor outside of nursing. Nursing, you definitely want one there, but certainly look outside of nursing and figure out what your shortfalls are to identify that person that you need. One of the things I see a lot with our nurse colleagues, a lot of us are not, we can't read spreadsheets and the like and not a lot, but I've seen it more with nursing in the government for sure. We have a hard time reading these budgets and creating budgets and doing things like that because it's not innate to what we do. But having that business savvy, that's one of the things that was a shortfall for me. So I needed to get a nurse colleague that was really strong in that area to help me with what I needed for the government. Well, right now I run the entire budget for our division, for all of CMS Dallas. And so that's quite a chunk of change that I'm responsible for. So all of that comes through me. And that's a skill set that I had to develop that, I've never had to utilize that. And, with DOD or the Uniformed Services, they tell you what you have and that's it, or someone else is stroking the check. But when you're the one that's the gatekeeper for those resources, it takes on a whole different meaning.
Yeah, I 100% agree. Actually, within my own university, I have a non-nurse mentor that, she's got experience within the university, and she's got experience that I don't have within the university. So navigating the university ins and outs is something that, she's a genius at. So I appreciate that advice because it's very true. And I'll have to look up these executive coach names you dropped. So I'll put that on the website too as soon as I find them. So thank you so much for your time. It's been fantastic speaking with you. We have been listening to Captain James Dickens. He is a commissioned officer in the United States Public Health Services Commission Corps. And I look forward to your career after this. I'm looking forward to see what you do next. So thank you so much again for joining me.
Thank you.
You've been listening to the RN Mentor with your host, Ali Tayeb. Please don't forget to visit www.alirtayeb.com. That's www.alirtayeb.com for podcast notes and resources. And don't forget to subscribe. Until next time, I wish you fair winds and following seas.